nobody at Ridgecrest Memorial could agree on, when Sabrina Odom had started working there. That was the strange part. Ask the charge nurse on the 4th floor, and she'd say late September, maybe October. Ask the unit clerk at the front desk, and she'd shrug and say she'd always just been there. Ask anyone in the ER, and you'd get a different answer every time, because nobody had really paid attention when Sabrina arrived. She hadn't made them. She'd simply shown up one Tuesday morning in dark green scrubs, with her badge already clipped to her chest, and her hair pulled back with the kind of no-nonsense efficiency that suggested she had been doing this since before some of her coworkers had graduated high school, which was closer to the truth than any of them knew. She worked nights mostly, and then days when they were short, and occasionally doubles when the staffing coordinator called her at 11 in the evening, with that particular tone of desperate apology that Sabrina never once made her finish. She'd just say she'd be there and she'd show up, and she'd work the shift without complaint and without theater, and at the end of it she'd go home to her apartment on the east side of town, where nobody bothered her and where she kept her curtains drawn, and her phone on the kitchen counter. She was 31 years old. She looked younger and moved older with the deliberate economy of someone who had learned a long time ago that wasted motion cost you things you couldn't get back. The ER at Ridgecrest was run in the way that matters, not by the department head but by a senior trauma nurse named Gwen Alcott. Alcott had been there for 16 years and had the kind of territorial authority that comes not from a title, but from simply outlasting everyone who'd ever tried to challenge her. She had opinions about everything. About which residents were worth teaching, about which attendings were impossible, about which new hires would last and which were wasting her time. She formed her opinions quickly and did not revise them. When Sabrina started, Alcott looked her over once at the nurses' station, assessed her without speaking, and turned back to her computer. That was the entirety of her welcome. The others followed Alcott's lead, because that was what you did at Ridgecrest. Within 2 weeks the small cruelties had begun, the kind so specific to high-stakes workplaces that they barely register as cruelty at all. Sabrina got the worst assignment groupings, the most unpredictable patients, the rooms that required the most running. She was left off the group text that went around when someone brought food in. She was assigned to restocking duty twice in 1 week, a task that was generally rotated, which Alcott justified by saying the new hire should know where everything was. As if Sabrina had not already demonstrated repeatedly and without comment that she knew exactly where everything was. A senior nurse named Phoebe Carver watched all of this and said nothing, which was its own kind of participation. Sabrina said nothing either. She took the hard assignments and she worked them. She restocked the supply rooms with quiet thoroughness, and noticed 3 things that were consistently in the wrong place, and corrected them without making an announcement about it. She arrived early for every shift and stayed until the handoff was clean. She ate her lunch alone at a corner table in the cafeteria, reading something nobody ever got close enough to identify, and she went back to work. The attending physicians barely registered her presence. The ER director, Dr. Franklin Morse, was the kind of man who had been excellent once, and had spent the subsequent decade being comfortable. He was not unkind exactly, just fundamentally uninterested in the nurses beneath him, unless they created a problem. Sabrina didn't create problems. Sabrina solved them quietly, before they became visible to anyone who outranked her, which meant Dr. Morse had no occasion to notice her at all. There was one doctor who was different. Dr. Amelia Tran was a second-year resident, who had not yet learned to perform exhaustion as a status symbol, which meant she still actually noticed things. She noticed that Sabrina's assessments were faster than anyone else's and more complete. She noticed that Sabrina could start an IV in conditions that made the other nurses call for help. She noticed that Sabrina's vital sign interpretation preceded the monitors by a margin that should not have been statistically possible, as if she were reading the patient instead of the machine. Dr. Tran tried once to ask Sabrina where she'd trained. Sabrina had said a nursing program in the Southeast and then changed the subject. Dr. Tran had let it go, but she did not forget it. The locker Sabrina used on the 3rd floor held nothing personal. No photos, no sticky notes, no half-finished crossword puzzle. There was a spare set of scrubs folded with geometric precision, a small waterproof notebook, a trauma reference card in a laminate sleeve that had been handled so many times the edges were soft, and tucked into the back corner, visible only if you were looking. A small patch. Dark fabric, embroidered, depicting a symbol that none of the nurses who occasionally glanced inside would have recognized, but which would have meant something immediate and specific to anyone who had served in the right places. Nobody was looking that closely at Sabrina Odom. People rarely look closely at the person who makes things easier, without asking for anything in return. The shift that changed everything started ordinarily, which is how those shifts always start. It was a Thursday evening in late November. The ER was running at about 70% capacity, which at Ridgecrest meant controlled stress, the kind the staff had learned to metabolize as a baseline. Sabrina had been assigned to the East Pod 4 rooms, a reasonable load. Room 2 had a 60-year-old with chest pain, whose EKG was bothering her in a way she couldn't yet articulate. Room 3 had a teenager with a broken wrist. Room 4 was empty. Room 1 had a man named George Pressman, 68, admitted for what his wife had described over the phone as sudden confusion and a bad headache. Dr. Morse had cleared Pressman in under 4 minutes. Quick neurocheck, blood pressure slightly elevated but not alarming. No focal deficits on a cursory exam. He wrote it up as hypertensive episode, ordered labs and observation, and moved to the next patient. Sabrina read the chart. Then she read it again. Then she stood at the foot of Pressman's bed and watched him for 45 seconds without touching anything. His wife, a small woman with reading glasses on a beaded chain, sat in the plastic chair beside him, and watched Sabrina watch her husband with the particular alertness of a spouse who has learned that the people who stop and look are worth paying attention to. Pressman was answering questions. He knew his name, the date, who the president was. He was oriented on paper, he was fine. Sabrina asked him to raise both arms above his head and hold them there. She asked him to smile. She asked him to repeat a sentence back to her. He did all three. She noted the drift in his left arm, slight 3 seconds in. A tremor that wasn't there at the start. She noted that his smile pulled fractionally more to the right than to the left. She noted a half-second hesitation before the repeated sentence that his wife would not have caught, and that Dr. Morse had not waited for. She went to the nursing station. Alcott was there, reviewing assignments for the overnight shift. "I need Dr. Morse back in room 1, Sabrina said. Alcott looked up with the expression she reserved for inefficiency. "Morse cleared Pressman 20 minutes ago." "I know he did. Do you have new vitals?" "I have a clinical observation." There was a pause, the kind Alcott deployed with some skill, long enough to establish who was in charge of this conversation. "Document your observation," Alcott said, "and if his vitals change, page the resident." Sabrina held the pause for exactly 1 beat. Then she said, "I believe Mr. Pressman is having an ischemic stroke. I'd like someone to see him before that window closes." Alcott stared at her. The 2 junior nurses at the station did not look up from their monitors, but neither of them was typing anymore. "He passed the neuroscreen," Alcott said. "Fast screens miss subtle cortical involvement. He has left arm drift and right side facial asymmetry on repeat exam." There was a longer silence now. "Get Dr. Tran," Alcott said. To no one in particular. Dr. Tran was in room 1 inside 90 seconds. She repeated Sabrina's exam. Then she repeated it a second time with the slightly elevated attention of someone who was confirming what they already suspected. She came out of the room and called for a stroke code, her voice carrying the particular steadiness of someone who understood the arithmetic of minutes. Dr. Morse appeared 90 seconds after that, drawn by the code actation, and stood in the doorway of room 1 while the team moved. The CT confirmed a left MCA territory ischemic stroke, early changes, still within the treatment window. Pressman was in neuro-intervention within 22 minutes of Sabrina's clinical call. The attending neurologist, Dr. Ross Elgin, found Sabrina at the nurses' station afterward and asked her what she'd seen. She told him clinical and brief. He looked at her for a moment in the way doctors sometimes look at people who have just told them something they wished they'd found themselves. "You trained where?" he said. "Southeast," she said. He nodded slowly. He did not push it. He wrote something in his notes and left. Dr. Morse did not come to find Sabrina. He did write in his post-event debrief that the nursing staff had appropriately escalated a concern, which was accurate in the way that calling the Pacific Ocean a large body of water was accurate. Alcott read the debrief and said nothing to Sabrina directly. She said something to Phoebe Carver in the break room that Sabrina did not hear, but she caught the shape of it in the way. Carver glanced at her when she came back from her dinner break, the reassessment that wasn't quite an apology. 2 days later, Alcott assigned her to restocking again. Sabrina put everything back in the right place. Then she found the 3 items that had migrated back to their incorrect positions, and corrected them again. She went home. She fed the cat she never mentioned to anyone at work. She sat on her couch in the dark for a while, not from sadness but from habit, from a long ego training in what stillness could tell you when you let it. Then she went to bed. 3 weeks passed. The ER cycled through its rhythms. Pressman sent a card to the nursing station that Alcott taped to the wall, near the coffee machine without comment. His name was written in shaky left-handed script. Because his right hand was still recovering, which the card did not mention, but which everyone who read it understood. Sabrina read it once and went back to work. It was a Monday morning when the second thing happened. The thing that could not be explained away as lucky timing or beginner's coincidence, or the benefit of good instincts. A call came in at 0742. The charge desk took. Not a 911 dispatch, not a standard transfer request. A direct call to the ER desk from a number the unit clerk didn't recognize. Routed through 2 intermediary lines. And when she answered, the voice on the other end asked, not for the charge nurse, not for the attending, but for someone by a name that was not on any badge or any roster at Ridgecrest Memorial Hospital. The unit clerk, whose name was Jenny and who was 23, and had been on the job for 8 months, said she didn't think they had anyone by that name. The voice said, she's on shift. Tell her Kessler sends word. Jenny, confused, put the call on hold and leaned over to Alcott, who was 3 feet away. Alcott took the information with the expression of someone who did not like unexplained things. She looked across the station to where Sabrina was updating a chart. Someone's asking for you, Alcott said. Different name. Sabrina looked up. Her expression did not change. She set down her pen, crossed to the desk, picked up the handset and listened for 11 seconds without speaking. Then she said 2 words. Then she hung up and returned to her chart. Alcott watched her for a long moment. Everything okay? Yes, Sabrina said. Thank you. It was the most she had ever said to Alcott that was not clinically necessary. And Alcott found, to her own mild surprise, that she did not press further. That afternoon, Sabrina requested a 3-day leave of absence, citing personal reasons, and left before the end of her shift for the first time since she'd started working there. Nobody thought much of it. People had personal reasons. That was normal. Alcott reassigned her patients and told Carver to cover the East Pod. On Thursday morning, Sabrina came back. She arrived at 0555, 5 minutes before her scheduled start, which was her normal time. She clipped her badge to her chest. She reviewed the overnight notes. She took the morning report from the departing shift nurse without sitting down. Nobody asked where she'd been. The following Tuesday the army came. There was no warning, no prior coordination with hospital administration, no call to the charge desk, no polite notification to the ER director. There was simply, at 0811 on a Tuesday morning, a convoy that pulled into the ambulance bay with the kind of controlled urgency that made the security guard at the bay doors step back without being asked. 2 vehicles dark. Government plates. The back doors of the second vehicle opened before it fully stopped. What came out was not a standard transfer. The soldiers who moved the gurney were not in hospital attire. They were in combat utilities, blouses still on. The particular combination of equipment and bearing. That means someone has come directly from somewhere. They cannot describe in a place that does not appear on tourist maps. One of them, a woman, had blood on her sleeve that wasn't hers. The patient was a man mid-30s, unconscious. 2 large bore IVs running wide open, field dressings on his right thigh and left flank, that had been applied with the specific technique of someone trained in hemorrhage control. Under circumstances where the alternative was losing the patient before you could reach care. He was in uniform. The rank and unit insignia had been removed. The team moved through the ambulance bay doors with the precision of people who had practiced this movement. A soldier in front, broad-shouldered face set, in the expressionless discipline of someone managing a crisis by sheer refusal to let it become one, stopped at the doors and spoke to no one in particular. We need Odom, he said. Not a request, a statement of logistics. Jenny, who had the misfortune and distinction of being at the desk again, said she'd get the charge nurse. We need Odom, the soldier said again, with the patient clarity of someone who did not plan to repeat himself a third time. Sabrina was already moving. She had heard the convoy before she saw it. The sound of military vehicles at speed through a civilian setting has a particular character, a weight and discipline in the engine note, and Sabrina had spent enough time in places where that sound meant something to identify it. Before anyone else in the ER had looked up, she had been at the window of room 3, assessing a patient, when the bay lights shifted. She was moving toward the doors before the vehicles stopped. She came through the bay entrance and the lead soldier saw her from 12 feet away, and something in his posture changed. Not relaxed exactly, but recalibrated. The infinitesimal adjustment of a person who has been carrying a problem alone, and has just located the person they needed. "Odom," he said. "What's the mechanism?" She said, already at the gurney, already reading the field dressings, calculating. "Iad fragment. Right thigh femoral proximity. Left flank penetration unclear depth. Field tourniquet applied at T+6. He's been down 40 minutes. She pulled the dressing back 2 inches and looked, then replaced it with a pressure that made one of the accompanying soldiers shift his weight involuntarily. Pressure trend? 80 systolic dropping. He was 92 when we loaded. Temp? 95.4. He's in shock, she said to the bay team that had assembled behind her. Trauma 2. I need O-neg on the rapid infuser, warm blankets, and someone get Dr. Tran in here now. We're not waiting for Morse, doctor. Morse had in fact already appeared at the bay entrance, drawn by the vehicles and the radio traffic, and the general atmosphere of something happening in his ER that had not been cleared through him. He was in his white coat. He had his arms slightly away from his body in the posture of authority approaching a situation it intends to manage. He was 6 feet from the trauma bay door when the lead soldier, without turning, without raising his voice, said, "Sir, we've requested a specific provider. Please hold clear of the bay, doctor." Morse stopped. He looked at the soldier. He looked at Sabrina. He looked at the gurney being pushed through the trauma bay doors. With the focused efficiency of a team that was not going to pause for an organizational conversation, he held clear of the bay. Inside, Sabrina worked with the unhurried speed. That is the particular signature of someone who has done this in worse conditions than a well-lit level 2 trauma center. She called the room the way a conductor calls an orchestra, not loudly, not with theater, just with the quiet certainty of someone whose directions do not require decoration. The bay team moved with her. Dr. Tran arrived 40 seconds later, read the room in the way she had learned to read rooms when Sabrina was in them, and fell in on the left side without needing to be told where to stand. Sabrina found the femoral involvement and controlled it. She identified the flank wound's trajectory from the entry angle and the patient's positioning, and told Dr. Tran what she expected to find. Before the ultrasound confirmed it, she called for the OR before the scan was finished, because the scan was going to tell them what she already knew. And every minute they waited was a minute. The patient was spending blood he did not have to spend. The OR team was ready when they arrived. The surgery took 2 hours and 40 minutes. Sabrina was in the room for the first 90 of them, assisting and directing, and at 3 points in the procedure, identifying things ahead of the surgical team that left the attending a vascular surgeon named Dr. Nathaniel Poole, who had operated on trauma patients for 22 years, quietly recalibrating his understanding of what a trauma nurse could know. When it was over, when the patient was in recovery and his pressure was stable, and the team outside the OR had finally exhaled, Sabrina went to the scrub sink and began the process of unwinding. The lead soldier found her there. He was quieter now, not softer exactly, but the crisis management register had dropped, and what was underneath it was something more human and considerably more tired. "He's going to be okay," she said before he could ask. The soldier nodded once. He was quiet for a moment. "Command said you were the one," he said. "When we got the call, they gave us this hospital, your name, and told us not to make any other decisions." Sabrina said nothing to that. She kept her eyes on the sink. "I've known Hayward for 6 years," the soldier said. The name meant something to Sabrina. Something moved across her face. Brief and controlled. The way feeling moves across the face of a person who has learned to keep it from becoming a story. "He told me once that if anything happened out there, the only person he'd want working on him was the woman who taught him how to pack a wound in the first place." Sabrina shut off the water. She reached for the paper towels. "He always did have poor taste in teachers," she said. The soldier almost smiled. Almost. He started to say something else. Something about her old unit, about people who still talked about her, about a time in a country she had not thought about today, until this exact moment. She stopped him gently. The way she stopped everything she didn't need, cleanly and without cruelty. "I'm just the Tuesday-Thursday night nurse," she said. She folded the paper towels and put them in the bin, and walked back toward the R floor with the same unhurried steadiness. She'd walked in with every shift since September badge against her chest, eyes already moving to the next problem. Dr. Morse was in the corridor. He had been in the corridor, Sabrina suspected, for some time. He had the look of a man who had spent the last 3 hours in his office, reading a personnel file that had told him very little and understanding from that absence that it was supposed to. He looked at her. She looked back. He did not speak first. He was recalibrating. She could see it the way a man recalibrates when the coordinates he's been using turn out to have been wrong from the beginning. She had watched it happen before. It never looked quite the same twice. "Mrs. Odom," he said finally. "Dr. Morse," she said. A pause. He was choosing words with more care than he was accustomed to using. "The patient," he said. "Good outcome. So far," she said. "Dr. Tran will manage follow-up." He nodded. There was something else in his face. It was not quite an apology. Men like Morse did not arrive at apologies on short timelines. But there was the beginning of one, somewhere behind his eyes, and Sabrina had no interest in standing in the corridor and watching him find it. "Excuse me," she said, and walked past him. At the nurses' station, Alcott was standing with Phoebe Carver and Jenny and 2 other nurses, who had found reasons to be near the desk for the past 20 minutes. The kind of gathering that happens organically, when something significant has occurred and no one wants to be the last to understand it. Alcott watched Sabrina approach. Her expression was the most unguarded Sabrina had ever seen it. Not warm exactly. Something more honest than warm. The look of a person who has made a sustained error in judgment and is confronting it for the first time without defenses. Sabrina picked up the chart she'd left on the desk before the convoy arrived. She reviewed the last notation and updated it. She set the chart back down. Alcott said, "Sabrina." Sabrina looked up. Alcott held her gaze for a moment, then she said, "The pressman card, on the wall there. I should have put your name on it." It was not a large thing to say. It was also not a small thing. Sabrina understood the weight Alcott had carried to get there, and she did not make her carry it any further. "It's fine," Sabrina said. "He's the one who got better." She picked up the next chart and moved toward her patient rooms. Carver watched her go. Jenny watched her go. The other nurses at the station watched her go. Nobody said anything for a moment, and then the ER came back into itself the way it always did. A radio crackling, a monitor alarming, gently on 3. The sound of wheels in the corridor, and everyone moved back to the work. Later, much later, after the day shift had turned over, and the early evening had settled into the ER's nighttime rhythm, a small conversation happened at the nursing station that nobody set out to have. It started because Jenny asked quietly and genuinely, and with the slightly embarrassed candor of someone who had been thinking about this for several hours, how it was that Sabrina had known. Carver said she didn't know she'd been there 8 years. And she'd never seen anyone move like that. Alcott, who was finishing her charting at the desk, didn't look up. But after a moment, she said in a tone that was neither proud nor ashamed but simply honest, that she didn't know either. Jenny thought about that then. She thought about the patch in Sabrina's locker that she'd glimpsed once and hadn't recognized. She thought about the name that wasn't on any roster. She thought about the soldiers, who had arrived, with no warning and no paperwork, and had not questioned for a single moment that the person they needed would be exactly where they'd been told she was. She thought about Sabrina, walking back to her patients like it was just another morning. "I think," Jenny said finally, "that she's just been a lot of places we haven't." Nobody argued with that. Down the hall in room 2, Sabrina was checking on an elderly woman with a hip fracture who had been worried. She'd told Sabrina earlier, not about the hip but about her dog, who was home alone and didn't know where she was. Sabrina told her they'd find someone to check on the dog. She said it the way. She said everything without theater, as if it were simply the next problem, and she had every intention of solving it. The woman looked at her, with the helpless gratitude of someone being cared for by a person who means it. And Sabrina took her vitals and noted, and put her hand briefly on the woman's and said she'd be back in 30 minutes. She was back in 28. Some people move through the world loudly, making sure you know what they've done, and who they are and what they've seen. They need the acknowledgement the way a room needs air. Sabrina Odom was not that kind of person. She had been other things before she was a night shift nurse at a mid-sized hospital in a city. She'd chosen because it was quiet and the ER needed good hands, and nobody there would know her name. She had been in places that did not exist in any press release, with people who trusted her, with the most consequential minutes of their lives. And she had come home from all of it with the particular knowledge that comes only to people who have operated without margin. She knew what mattered. She knew how to work. She knew that the woman in room 2 was afraid for her dog, and that fear was real and worth addressing. The challenge coin at the bottom of her locker drawer had a motto on its reverse side, worn now but still legible. She had not looked at it in months. She did not need to. She had lived the thing the motto was trying to say, for long enough that it no longer needed to be read. She had just needed for a little while a quiet ward and a regular shift, and the ordinary work of helping people through the worst days of their lives. Nobody at Ridgecrest Memorial mocked the quiet night nurse after Tuesday. Not because of the soldiers, or the vehicles, or the surgical outcome, or the name that no one could find in any public record. Not even because of Dr. Morse standing in the corridor with the look of a man doing arithmetic he didn't like. They stopped because Alcott had put Sabrina's name on the pressman card. She'd taken it off the wall and written it in the margin, small and clear, and put it back up. It was a small thing. It was also a beginning. Some people announce themselves when they arrive. Others are already working by the time you realize they've been there all along.